Just want to welcome everyone and thank you for being here today with us at the before and after analyzing pre and post survey in Excel. Nicole Shane Bourne is going to be walking us through this today, and we're going to learn a lot here shortly. Let's see. Is the poll question in a second, or did I? Okay, sorry about that. Let's see. Okay, let's go ahead and go to our acknowledgments page. And I'll just summarize this. You can look over it. Today's presentation is by the South-Southwest PTTC. It's under a cooperative agreement with SAMHSA, but it does not necessarily reflect the official position of SAMHSA or the Department of Health and Human Services. And our work today is supported by a grant. So let's go ahead and talk about our learning objectives. Okay. So during today's webinar, Nicole is going to talk about using the 4-step pre and post analysis process, and she's going to demonstrate it in Excel. But our objectives are to apply the step-by-step process to set up a pre and post test database in Excel and use Excel to analyze pre and post test survey outcomes. And Nicole will dive deeper into that 4-step process shortly. Okay. So let's go ahead and take a look at our roadmap. We are going to start with instructions. Or introductions. Many of y'all have already introduced yourself in the chat, and then we're going to move into the why you need to look at changes in the pre and post survey results. And then Nicole's going to walk us through that 4-step process that I mentioned, and then begin setting up and analyzing the data in Excel. And I did want to take a moment to talk about your options as a learner today. We did send out the instructions and the data in the spreadsheet beforehand, and I believe Richard has put that in the chat, so you can download it now. So the options are, you can open this and follow along side Nicole, or you can just observe and follow along and then work through it later. Because we are going to send out the recording and the materials for those who registered. So whatever your learning style is and however works best for you, that's absolutely fine. Personally, I like to watch and then do, but that may not be how you're wanting to do it. And learning this type of pre and post analysis, it's not really a once and done kind of skill you're going to do. It's going to take a little practice, but it is a step-by-step process and you can do it. So I believe in you, and Nicole's an amazing teacher and has included some fantastic resources for you. But trust me, you're going to learn a lot and you're going to be so proud, because this is a very useful skill to have. And then next we're going to look at the data and see that the story that's unfolded. What is the story that we see after it is all laid out, and where can we look at it? Then we're going to talk about the best way we can communicate the results. And then last but not least, we'll have time for questions, and then we'll have our survey to complete our survey at the end of the training. So let's go ahead and do introductions. I'm Sheila Boswell. I am the Evaluation and Design Coordinator here at the South-Southwest PTTC. And I am lucky to get to work beside these two amazing people, Dr. Beverly Triana Tremaine. She's our epidemiologist at the South-Southwest PTTC. She wears many hats because she has so much knowledge about data and public health. She's an author. She's an expert in process and impact evaluation and research methodology. She has 30 years of experience providing training and technical assistance about data-driven public health interventions, and I'm just in awe when I get to work with her. So next we have our presenter today, and Nicole Shaneborn. She is our Southwest PTTC evaluator, and she's going to share her knowledge with us. Not only does she serve as our evaluator, she is also a true innovator when it comes to using data to make decisions that create change. And she has 20 years of experience in public health with a focus on data-informed prevention to achieve successful outcomes. She works with states, tribes, communities to address health disparities, and she is my go-to anytime I need something. And today we are going to learn so much from her. So without further ado, I'm going to hand it over to Nicole.
Oh, thank you, Sheila. And as you can see, that none of this happens on its own. There are many people who touch the materials, who help with the tech, who help with the content. And I want to acknowledge Wanda West, Richard, and Shannon, who are helping us behind the scenes with our tech and chat and just making sure I stay on task and on time, which, you know, I can get a little chatty. So Wanda makes this show run. So I am just thrilled to be with such a great team that are here to support me and to support all of you as we go through a topic that can be a little intimidating, right? But I want to just remind you that even me, even Bev, even Sheila, who do this, you know, a lot, it still takes us going back and following the steps. And so it's really important just to like take a deep breath, you know, take a deep breath right now if you want. Right? Because math is sometimes a scary thing for people. And I use data a lot now, but when I was a kid, this was my worst subject. So I want to extend that to you all to know that you can start somewhere and be confident in that. I was a kid that loved to write, loved to do all the things except math. And then when I went to school, I discovered statistics and how it could be applied to help people. And that's what drove me to want to do this. So I say that to say, take it all in. You don't have to be perfect at it. It takes practice. It still takes me practice to go through it. And so we've outlined all those steps in our instructions handout for you. We don't expect people to get this right away, honestly. It's something that it can be a bit repetitive to learn correctly. And so I encourage you to go back and practice, to go back to our recording that we'll send you in a week, to go back to those instructions so that you can go back through this at your own pace if you want. What's great about recordings is we can hit pause, we can rewind, we can do all the things, right? And so it's great to have the technology to go back through this on your own and do it at your own pace as well. Today we will have to move fairly quickly just because we only have an hour and a half. And so if you end up having technical issues, if you're trying to do it as you follow along, don't fret. You can just sit back and watch me go through it and know that when you leave today, you're going to get these materials and you can go back through it on your own. If you're in our region, we also offer customized technical assistance. So you're always welcome to contact us and we'll share that information at the end to help you walk through this. Okay. So I just wanted to say that because I definitely come from a background of not liking math and being afraid. And it does take a bit of, making sure you relax, you breathe, and know that it's going to be okay. We will get through it, and it'll actually be fun. I promise you. Because, you can take this data and do something with it for your communities, which is what we're here for. So with that, I want to start off with a question for you all. Why do you think it is essential for prevention professionals to examine pre and post data? Why do you think it's important? And you can post your answers in the chat. We'd love to hear from you. We also welcome people opening up their line if they'd like to just talk. We are open to that too. I see some things coming through already. Wow, you guys are doing great. I see some to know if we're on the right track. What else are we seeing there, Sheila and Bev?
Yeah, many great answers. I love to see value. That is the purpose of evaluation, is to see merit, worth, and value, and to measure impact. And several of the answers where we have to know if we're helping people. And that obviously is your ultimate impact. You want to know that you're helping people. Helps you set goals, course correct, and improve. I like that, Margot. Excellent.
Yeah, and that really gets to another thing that data is great for is quality improvement. We don't have to wait. Today we'll be talking about outcomes more, but we don't have to wait till the end. When we get done with our program, we can look at things along the way to see if they're working too. So great points. Measure success. Yeah. Great. All right. Well, thank you for all your participation. That makes me talking to the screen a lot easier, so I appreciate it. I am definitely someone who likes interaction in an in-person training, and so I welcome a lot of your participation in the chat and opening up the line. It lets me know y'all are out there, so good to hear from you. So why does this matter? Why does this matter as a prevention specialist? So I have this wonderful colleague named Dr. Tremaine who did actually bring this into another training, and we thought it was really useful to remind you of just the prevention specialist tasks from the ICNRC. And if some of you aren't familiar with that, that's the International Certification and Reciprocity Consortium. It is a mouthful, but it is our credentialing body nationally, internationally that writes the exam, provides all those standards for us. And then of course, in each of our states, we have our local credentialing bodies. And so these are some of the things taken from the ICNRC prevention specialist competencies that apply to the topic today and to data in general. So you can see we've got to know how to report data. We need to look at social determinants of health to know how our services are impacting different populations. We need to know if people are experiencing health disparities. We need to look at how we collect data and just those basic terms. And we'll go over some of those today for looking at statistical significance, which sounds scary, but it's not, I promise you. And then problem identification. What do we need to examine in our prevention community? It goes back to our fifth step of assessment, right? And our fifth steps of evaluation. And really looking at those community characteristics to determine the context of your community. So really looking at the effectiveness of our interventions, which is what statistical tests do, really helps us examine if what we are doing is working for different types of people. Do we have disparities? Do we have significant differences in what they're experiencing? All of those things relate to our competencies as well as the SPIF. And so hence, here we are today talking about statistical significance. So what are we looking at in pre and post tests? So one of the things we look at is differences in outcomes for individuals, right? Are we looking at, did someone have a significant change in their, let's say, in their substance use rates? before and after an intervention. Okay, so did that change significantly over time after receiving some support? Also, we want to see if we're getting differences in outcomes across groups. So for the group, did we see a significant change? And that's where we kind of get into looking at what we call means, which are just averages, and comparing those to see if there are differences across the entire group that we're seeing. So did those scores change pre and post significantly for the entire group? So those are the main things we look at. What are some things that you all in your communities have used statistical tests for? You can post that in the chat. It looks like we've got some coming in.
Measure increase of knowledge, curriculum development and piloting, attitude changes, program effectiveness, and to see if our services are effective.
Very good. Very good. Perceived risk of harm, change in perceived risk of harm. Great. That's a really good one.
Mm-hmm. Significance among outcomes for different races, different SES.
Mm-hmm. Knowledge, races, ages, follow up on care coordination. Perfect. Yeah, so all of those things are things that we look for. And kudos to my team here. I did kind of a little impromptu question there, so I appreciate you stepping up, because sometimes I do that. So, but I felt it was important for you all to see what others are doing in your communities to assess some of these things.
Impromptu is good, Nicole. Keep going.
All right. That's what happens when you've got two parents as teachers. So. All right. So the benefits, what are the benefits to doing this? And we talked about some of these a little bit, but one big thing is we can demonstrate our impact to funders, right? So in prevention, all of us we are juggling so many different grants, contracts, discretionary funding, it doesn't all come from one place, does it? And so we've got to be able to take our data, our programs, and show that what we're doing is working and that it's effective. So one of those ways to do that is to show evidence of effectiveness. And sometimes we don't have evidence-based practices that work in our community. So we may have to do a different type of intervention, but we still want to be able to show that it's working so we can demonstrate that to our funder, because they're going to ask for that information. And trust me, being able to say, there's a statistically significant difference between this and this after receiving the program is way different than saying we saw a few people improve. So that's the type of evidence they want to see. Another thing is to suggest improvements for continued efforts. So we may find that something in our program isn't working or could be done better. That's the quality improvement piece, right? And so we can use our findings to inform funders, to inform program developers and others that this is a suggested improvement. We tried it. It looks like it's working. Here are some suggestions. We also can seek support for continuing the program, which is a big yes in our arena in prevention, continuing to advocate for support and continued programs. We also can gather information on the approach, and just so we can share that with others. Part of our jobs as prevention specialists is to share our findings with others and to share approaches that work well. And then finally, we can help determine if an approach would be appropriate to replicate in other locations. So sometimes we have an intervention or an evidence-based practice that has been proven to work in a certain context, right? but it hasn't been tested in another context. And so by replicating and advocating for others to replicate this intervention, we can continue to show the worth of the program in different settings. And Bev has made a comment here. We are calling anchoring, measuring, and is used many times in research. They are finding that people that don't know what they don't know before an intervention, and so asking afterwards allows people to have more knowledge about it. Great. It looks like that was
yeah, and a lot of times they will call that the retrospective pre-post test. So you know, how, you know, whatever we learn today, you can certainly still use that using these methods that Nicole talks about today. But that's an excellent way to take into consideration that, you know, people don't know what they don't know before, but afterwards, oh, okay, I didn't know as much about that. So, yeah.
Great. Thank you, Bev.
Mm-hmm.
And so we're going to talk about some steps that just outline a simple process for you to follow and just break this down succinctly as we walked through this. And so we'll go over, you know, things that lead to what doesn't work. How do we inform decision making? How do we improve our capacity to implement effective public health practice? And then also how we demonstrate effectiveness. But all of that depends on following these steps, right? We've got to follow the steps first. And so it's just a really kind of concrete way to take yourself through this process, especially if it's your first go through. So our 4-step process that Sheila alluded to earlier as well is we've got to know our purpose and our sample. Okay, first and foremost, why are we doing this? Who are we doing it with? And what are the characteristics? All of those things. We also need to determine our statistical tests or measurements. And after we do that, then we've got to prepare the database, right? Which often we underestimate how much time that can take. We probably get a lot of data in that has to be cleaned, that has to be prepared, that has to be labeled. And so that process can take a while. We won't go through all the steps of cleaning today, but we do have other webinars that we've done in the past where you can go back and watch some of those as well. And there's lots of resources online for that. But we will show you a really simple data set, how to set that up, and then analyze it. We also need to stress that one of the most important things you can do is your interpretation and how you communicate your findings. And that's why it's really important. It kind of cycles back up to your sample, right? Knowing your purpose and your sample, and then knowing your audience. So who is in my study? And then also, who do I need to communicate the findings to? And hopefully those participants are some of the people that you're communicating to. We always want to make sure that we provide our participants with the results, because they've been a huge part of the process and have helped us get where we are going. So always make sure that you get that community buy-in from your sample as well. All right. So we're going to go through these step by step. And our first step, we're going to break down for you. And I'm raising my hand just because I talk with my hands, so ignore that. It always recognizes my hand raises. So know your purpose and sample. What does the program hope to achieve, and what are the intended outcomes? And that's where you're going to go back and refer to that logic model. And I know a lot of you are familiar with the logic model. You want to just raise your hands if you have a current logic model, just so we can see how many of you are familiar with this. All right, seeing a lot. Great. Most grants require these. Sometimes these are the bane of our existence, right, in prevention, but they are a necessary evil. So what we can do is make sure that we've got that logic model to show our coalitions and show how these outcomes are tied to our logic model in our program. So that's one way we can do that. Are the participants in the pre and post test sample the same? So do we have different people in the pre-test than the post-test? Very important to know as we move into our determining statistical test piece. There's just a different way that we do that. So an example of this would be, I'm passing out my pre-survey to some folks. I make sure that they each assign themselves a number. They remember that number, and then after they receive the intervention, they use the same number to fill out their post-test. And so that would be an example of using the same folks, and you would have that matched then. Otherwise, in the real world, a lot of times we don't have the same people or we're missing data. And so we can also use statistical tests to handle that. Is there a way to match the pre and post test surveys for the participants? So I just kind of alluded to that. So if you've got a certain kind of ID you've generated, or a way to keep track of if they're the same person, we don't usually collect names on anything, so that's kind of a no-no, but you want to make sure that there's some way to connect the pre and post surveys if you are using the same folks. Any questions about that step so far? All right, don't see any. Are there any in the chat though?
No questions.
All right. Well, either you all are asleep or I explained that well, so hopefully it's that I explained it well. So one way to look at that, and we're going to bring up the logic model here, is we are going to look at our logic model and how it connects to our outcomes. So, and I do a lot of backwards logic modeling. So sometimes I'll look at my outcomes first and what do I want to achieve, right? I want to achieve a reduced substance use rate, let's say for a youth program. So that's my outcome. And then I go back to, well, what's my purpose? What are the goals under those priorities? Who do I have to help me with this? And what do I have? So that's our inputs. What resources are there? Do I have volunteers to help with this? Staffing, materials, promotion, all of that. And then our outputs are the basic numbers, right? How many participants did we have? How many activities did we do? So that's what some people will call your process data. And our outcomes are typically those more long-ranging things, and some people separate those into short-term, intermediate, and long-term. So that being said, this is a great way to help your communities tie what you're going to do in terms of addressing outcomes and statistical significance with the priorities in the community and with the resources that are available and the participants you have. So this is a great way to connect that. And I'm seeing some comments in the chat here. Let me check that.
Yeah, they're liking the slide, and I just pointed out that in a logic model, it's good to look retrospectively in the beginning when you're building it, because you know, we're all in it to have change in the community, in the world, the nation, whatever. And so looking retrospectively, that's a good thing to do.
Great. Thank you, Bev. And Bev also points out these logic models, you know, they can take any shape, form, color, circles, you know, this is just one example, but in general, it's a good idea to have some visual representation for where you're going when you're trying to stress to your communities. These are the significant things we hope to achieve, right? So, all right, great. Let's move on to our next step here. So we also need to determine our appropriate statistical tests or measurements, right? So we want to make sure, just as you all were pointing out in the chat earlier, you know, some different things that you have done. There were things that you went through that that helped you determine which route am I going to go. So Richard has posted a question here. What are some ways you have analyzed data for pre and post tests? So things that you have done that have helped you determine your statistical tests and measurements. So feel free to post those there, and we'll keep an eye on those too. I know we saw some other things that you talked about earlier too, in ways that you had looked at statistical tests as well. Excel spreadsheets, yes. we can't stress enough using Excel. It is free. We will show it today. we have used it in our whole Ditching the Discomfort with Data series, which I encourage you to check out on our website. Yes, there are some others, R and SurveyMonkey. And there's also statistical packages. There's SPSS, there's SAS, if you want to do some more advanced statistical work. But it is amazing how much Excel can do, that a lot of people aren't aware of. And we'll show you how to get that analysis tool pack today if you aren't aware of how to do that. Looking over here, we've got QR codes with random number assignments. That's great. That's a good way to do that. R and Stata. I haven't heard of Jamovi. I'll have to check that one out. Big R advocate. Feel free to email me. Oh, Chris is offering some assistance there. Awesome. Thank you, Chris. That is great. Awesome. Yeah, I'm not as familiar with R either. You tend to like stick to what you know, right? So it is a good idea to see what else is out there and other things that other people are using. So great. Thank you for offering that, Chris. All right. So we also want to talk to you in a little bit about some things like matched versus unmatched samples and how that will really impact the statistical tests that you use also. Thank you all for sharing your approaches. So comparing statistical tests, and I thought this was a great quote, that they are a way of mathematically determining whether two sets of data are significantly different from each other. So that's really all we're doing today, is we're seeing if they are significantly different from each other. And if they are, then that means what we're doing is working. So that's just a really easy way to think about it, that we're just looking at to see if those differences are significant in a statistical way. So let's go on and look at some terms. And we decided to include some of these because there's a lot of terminology out there. And even in Excel, we want to make sure that when you see the output that, you're a little bit familiar with these terms if you haven't seen them before. I know some of you are, it looks like some people are using R and things like that. So you've probably got some statistics background, but for those of you who this is just completely new, these are some basic things that you'll want to just kind of keep in your back pocket. And we have included these on our handout as well in the glossary section. So for this step, the terms that are important to know are the mean, and the mean is just the average of the numbers or scores. So if we have group 1, we average those scores, we get the mean, and group 2 and so on. The t-test is a statistic that we are going to demonstrate today. That doesn't mean it's the only one that you can use. It's just the one that is probably used the most when comparing pre and post tests, especially when you just have 2 groups. If you have more than 2 groups, you'll have to do something different. So sorry about that. But today we're going to focus on the ones that work for the 2 groups, the pre and post. So the t-test tells you if there are significant differences between the group means. It also lets you know if those differences could have happened by chance. So if you have some differences, there may be some that you see, like in the mean, but that doesn't mean that they're necessarily statistically significant. So that's why this is important. And then the paired t-test just means that the samples are matched. So we have the same people in the pre and the same people in the post. And so we would use a paired t-test in that case. And then the unpaired is when they're unmatched. So we have different people in each group that we're comparing. So that's usually is 2 different samples. So for example, we'll be providing a run through of how you would look at 2 different samples at the end of an intervention using the unpaired t-test. So anyway, so let me check in with the chat here. Sheila and Bev, we have any questions or anything that folks have posted or anything you want to highlight?
No questions right now.
Okay.
Yeah, no questions. I did, just looking back, put some resources on generating a logic model using a tool. So those are just a few. You can look at those and see what you think.
All right, great. Thank you. Thank you. Okay, so we also wanted to provide some examples from the field, and these are included in your references section at the end of the PowerPoint. You'll be getting these. And so one of those is the Keeping It Real adaptation. Some of you may be familiar with that intervention. It's an evidence-based practice, but in this instance, they adapted it with linguistically in Guatemala City. And so they're using pre and post tests here to look at, did we still see, significant differences for these kids before and after the intervention, even with the linguistic adaptation. So that's taking, an evidence-based practice and doing some adaptation and then testing it to see if they're still having those significant results. So that's another way to use pre and post tests is adaptation. And that happens frequently in our field as prevention specialists, right? We've got all these evidence-based practices and, they've been conducted in this particular community with these particular people in this particular language. And so we do have to make sure that our findings are still significant and are working when we make those adaptations. So that's one way to use pre and post using adaptation. Then the parenting program example, and these are all linked for you. I won't go to them right now just because they're, journal articles with tiny print. You're not gonna be able to see any of it anyway. But feel free to look those up because we will have those in our references section as well. But the parenting program was looking at, among families with Latino youth, these are in particular immigrant families, was this intervention effective? And so again, this is being done on a particular population to make sure that we're still seeing similar results and that it's effective. And also in this case, there wasn't a lot of parenting programs for Latino families, specifically immigrant. And so this was a way to use, pre and post test findings and look at statistical significance to see if this was effective to add some evidence to the field. So again, something we need to do in prevention. We can't always find what we're looking for in our evidence-based registries that exactly fit our communities. And so using statistical tests is a good way to provide that evidence. All right. Any questions about that before I move on? Seeing lots of things in the chat about QR codes. Looks like a great discussion going on there. Looks like that may be another training in itself there.
Yeah.
Awesome. All right. Some great knowledge also in our participants always. And so we appreciate all the experience and, help that you provide as a participant to other folks too. All right. So we are now getting to our step 3, which is kind of it is more of the focus of our presentation today. That's what our live demo is going to cover too. And so in this, we're analyzing our data, We're going to use an example for you, and this is fake data. I want to stress that these are not actual scores from anybody. So don't start thinking, oh no, my exam score is up there on the screen from the prevention specialist exam. Not true. It is all fake, but it's a good way to demonstrate how to analyze pre and post test data. And so the question that we're analyzing for all of our participants is, what was your score? But that's going to be looked at in the first example before an exam prep course is done, what their score was, and then after they received the exam prep course, did their score increase significantly? And then, obviously we're also looking at the group. Did the group scores on average increase significantly? So that is one of our examples. The other one, we're actually going to look at two different groups of people that went through different formats of the exam prep course. So one is going to be, they got a virtual delivery of the course and then they took the post test. And then another group got an in-person version of the same material and then also took a post test. And looking at the differences between, was one particular format better than the other for learning and, more likelihood to pass the exam, basically. So those are the two examples we're going to walk through in Excel. We're going to go over some tips for setting up your data and variables very briefly. It's a very simple database. We also will cover briefly the data analysis tool pack, which is an add-in in Excel that you can use to do a lot. Specifically today, we'll just be focusing in on the t-test part of that. And then I just always want to encourage you all to use what you learned today to go beyond percent change. Often we talk about, well, our participants increased in percentage this much on, let's say, their exam score. But what we really want to get to, and that's important, it's not that it's not important, but we want to be able to say, over between these two groups, between the pre-test and the post-test, overall, we had some significant differences in pre-test and post-test scores that adds to the evidence of effectiveness instead of just focusing on just that percent change, because we don't know if that percent change was necessarily significant, right? So that's the point of all of this. And so that's what we'll be demonstrating to you today. All right, some more terms to know just before we go into this. We've got what's called the p-value. And I just always want to say P stands for probability, right? We've all had those examples of like, I'm rolling the dice and what's the probability of me getting this, so that's what probability is. It measures the likelihood that there's an observed difference between groups and whether that's due to chance or not. So that's what we're really looking at when we look at significance. So the null hypothesis sounds like a scary word, but it basically means, and I try to think of null as meaning nothing, right? Nothing's happening. It states that there is no relationship between the two variables studied. So let's say our pre-test and our post-test, which are our two variables, there was no difference between those scores that was statistically significant, okay? So one variable is not affecting the other. On the other side of that, we have what's called our alternative hypothesis, and that is where our independent variable, which is the variable we're manipulating. In our case, let's say we're looking at the different formats, right, of an intervention. So that's our independent variable, which is training format. Did that affect our scores, which is our dependent variable? So, and the results, if they're significant, then that means that what we're doing worked. So our alternative hypothesis is typically this worked. The null hypothesis is it didn't work. If there are differences, that was probably due to chance and chance alone. The alternative is that it's not due to chance alone that we're seeing some differences. So hopefully that all makes sense. Let me check the chat here to see if we've got any questions before we go on here. Oh, I see a question. Okay, Christina, when you say statistically significant, what does that mean? 3% more or less. How do you determine? Okay, so on the next slide, Christina, let me go to that because we do have some interpretation here. So a p-value, the probability value, less than or equal to your significance level. So our significance level is usually less or equal to 0.05. And that would mean if we're less or equal to 0.05, we have statistical significance. So this is typically the standard that this is set at. Now, some folks will take that even further to like 0.01, which just means they have more significance. But this is what we're going to be focusing on today. And most research is done using the 0.05 level. So 5%. In prevention, this means that what we did is working. Our outcomes are not due to random chance, and we will reject that null hypothesis that nothing is going on and accept that alternative hypothesis. Yay, a relationship exists. So that's what it means when we have statistical significance. So hopefully that makes a little sense. It'll make more sense too once we actually show the demonstration, Christina. And then when we don't have statistical significance, that means our probability level is greater than the significance level. So this would be not statistically significant. So if we see something greater than the 0.05, right, then that is not usually statistically significant in terms of what most researchers go by. So in prevention, this means that what we did may not be working to get to our outcome. So we got to take a look at this. We would want to see if we want to continue this program. Do we want to keep investing money in the intervention? So that's why this matters. I will caution you that if you have a small sample, you may want to go ahead and repeat the intervention one more time, because sometimes we don't see statistical significance if it's kind of close, if we don't have a big enough sample. So just to caution you there. So in statistical language, this would indicate strong evidence for the null hypothesis that there is no relationship. Nothing is going on when we see that greater than 0.05. So, all right. So we've got all these terms now. What does this all mean, Nicole? I'd like to see this. So that's what we're going to do. Let me go ahead and move over now to our live demo. And Richard, thank you. Richard has posted the before and after data examples that we'll use. Again, they are very simple ones because we just want to demonstrate this process today. So you can download that. Also, Richard has posted our handout that has all the instructions for the before and after. So again, we will also send these out in a week with all of our materials. But if you'd like to have it with you today, please make sure you download those. All right. Connor, I see a question. Will we be going over sample size? We will not necessarily be going over what you would want for sample size today. I think that's probably what you're asking. If you'd like some resources on that, we can go ahead and get those to you. If you would like to send, you can post your email in the chat, and Dr. Tremaine, Sheila, and I will make sure we get back to you on that. Today, we will be using a very small sample just to demonstrate. All right, so.
Nicole, I will put in the chat a sample size calculator. So based on your population size, the confidence level that you wish, and the margin error, what it would suggest that you have as a sample size. So I'll put some of those in there.
Thank you, Bev. Yeah, there's some really cool tools now available that help you with that. So thank you for putting those in there. And Jasmine also has put their information in there for the data samples. So great. Again, always super helpful people in our participants, and we appreciate that and how you help your peers. All right. So I'm going to exit out PowerPoint here for a minute and get into my Excel. Bear with me here. Okay, and just if a few of you will give me your thumbs up that you can see the data in Excel, just to make sure.
We're seeing your PowerPoint still
You are.
right
Okay.
now. Yeah.
All right. Well, that's why I asked, because sometimes this gets a little funky. All right. How's it looking now?
Yep, we see the Excel spreadsheet.
Perfect.
Your
Perfect.
dates.
All right. So this is going to be our little data set we're going to work with first. But before we go into that, I do want to just quickly give you a walkthrough of the data analysis toolpack and how to get that. It is also in your instructions. So for those of you that don't have it, you can just go to File and go to your options down here, at the very bottom. And you'll go on the left, you'll see add-ins. So just click on that. And at the bottom again, you'll see Excel add-ins where it says manage. And I'm just going to click on that go. And notice this is also a way to check to see if you have it. So I have it, it's already checked, right? But if it's not checked, you don't have the analysis tool pack installed in Excel. So that's where you would go to get that. And then you would just click OK, and it will bring it in for you. For those of you who are a little more advanced, there's also the analysis tool pack VBA, which is with Virtual Basic. If you know how to code in Virtual Basic and you prefer to do things in there, you can go ahead and take that one as well. But today I will be just using the analysis tool pack, just so you know. But I know we've got some more experienced folks in here as well. So I wanted to point out that if you like to code, there you go.
Nicole, can you increase the size just a tad? I think so. Down at the bottom, maybe the little slide thing down there.
Yes, thank you, Bev. It's not letting you.
Is it not letting you do it? Oh,
Let me
interesting.
Yeah, maybe it's because I'm sharing. I don't know. Let me close out of this.
Oh, I think that may
Could
be
be because you had the pop-up window.
It was mad at
there you go. There you go.
mad at me.
Sorry about that.
No, that's okay. And let me decrease this a little bit so I can see it.
That may.
There we go. Is that better, everybody?
Yes, that's great.
Yeah, I think that will work.
All right. So now that you have your analysis tool pack, what you will do is go to data, and then you'll see data analysis over here at the far right. It's kind of up there by itself, on mine at least. And so I'm going to go ahead and open that up. And since I actually have the same participants here. So you'll notice that I've got 1 through 15, and they each have 2 scores, one on the pre-test and one on the post-test. And also you want to make sure you've got your labels set up here. It just makes your output easier. So when you're setting this up, make sure you label your columns like I have. I mean, you can label them what makes sense to you, but just know that that'll be used in your output and just helps kind of make it clearer when you get to that point. So
Yeah, and Nicole, let me just say something really quickly here.
sure.
I know that we have like a perfect data set right here, and you could tell me about when you get a real data set out in the real world, it's not going to be perfect. You're going to have missing data. And that you could take an entire course on how to handle missing data. So there's some sources I gave you. You also have to ask yourself, is the missing data, is it a systematic issue? Is it more a certain question, or is it a randomness missing data? So it's kind of beyond the scope of today, but look at those articles I gave. It'll at least get you started on identifying. There's several methods for dealing with missing data I won't go into, but just so that you start to understand, that's more complicated than what we can say right here.
Right. That's the whole thing in itself. But yes,
Yeah.
we often don't have perfect data, and there's ways that you can account for missing data and things. And so thank you, Bev, for going ahead and putting those resources there for folks.
Okay.
So since we have a paired t-test, also called the match t-test, we're going to go ahead and select this one right there. So, but as you see, the analysis tool pack gives you a lot of stuff here. And this is free. This is free. So you've got your own little statistical package right here in Excel, which is awesome. So we're going to go ahead and demonstrate this one. And so I've got, and I'll just show you because I think this came up automatically, but you'll go in here and highlight, also including your column header or the label at the top called pretest, just so Excel knows which variable this is. And then you just hit this again, the little down arrow, and it puts it in there. And then I'm going to go to variable 2. And I'm going to click that arrow again. And I'm going to highlight the post-test column this time, including that header. And then just click my arrow again. So now I've got my data in there for both variable 1 and variable 2. Then you're going to see this thing called hypothesized mean difference. What is that? Well, we're basically assuming the null hypothesis here. So we're going to put 0, that there is no, mean difference, and that will run our test for us. So that's pretty standard. There are situations where you might do something differently, but we won't get into that today. But just for now, know that you usually put in 0 there. And then we will also check labels because, again, like I said earlier, we want to make sure that our column headers are brought into our output, so it's a lot cleaner to see what's going on. Our alpha, so remember that P, the probability level, and we talked about 0.05? That's what this is. We're telling Excel, this is the significance level we are looking at. This is what value we want it to compare against. Okay. So that is alpha. And then this bottom part, I wouldn't worry about too much. It really is just, where do you want your analysis to go? So the output range, you could put in a specific range. For today, we're going to just go with the default. So it's going to open up a new worksheet down here where you see the plus sign for me, and put the analysis there. So let's go ahead and do this thing. We're going to hit OK. This is what we get. One thing that helps a lot, and some of you who are new to Excel, this may be a new trick. You can get on that column there where I have, and you see the little crosshairs, and you just double click on that column, and it automatically sets the column width to the width of your data. So I'm going to do that again. And I'm going to go here and do it again. So the next thing I'm going to do, just for ease of presentation today, and just so this stuff is not super confusing, I'm going to go ahead and delete some things that I'm not going to talk about today. So we're going to go down. We already talked about that mean difference. We don't need that. I'm basically going to focus in on our significance here. All right. Just to make it easier to read for you. Okay. So what I've got here, I'm going to put this in yellow here. This is that significance level we were talking about. This is the one that if it's 0.05 or less, then that means we've got statistical significance, right? If it's greater than 0.05, it's not significant. So I'm going to go ahead and blow this up a little bit because that came in a little smaller. There we go. Make it a little easier for y'all to see. And so what would you say in this case? Do we have statistical significance or do we not? Oh, Bridget, yes, we do. Very good. Very good. And so when we talk about, yes. So in that case, we use that hypothesis thing, right? We say we have statistical significance, which means we are accepting the alternative hypothesis that there is a difference. Okay. There's a statistically significant difference in pre to post test scores after receiving the exam prep course. So we made a difference. If we had the opposite, then we might have to go back and say, well, I don't know if it's worth the money or the time or all of that to do this course. Maybe we just provide them with a manual or something because we still had the same types of scores pre and post. So, but in this case, it looks like what we did is working. So we will put here that we reject the null hypothesis that our exam prep course is not working and accept our alternative, if I can spell, hypothesis. We have significance. All right. So you all are awesome. I saw a lot of yeses in the chat and hopefully that makes sense. Katie says I'm having flashbacks. Yes. So true. But basically, again, think about the null hypothesis, meaning nothing is going on. It's easy because both start with ends, right? Nothing's going on. And then we say that we are going to accept our alternative. That means we do have something going on and what we're doing is working. So, all right, that is example 1. Let me look at the chat here. Is it the first sentence of double decker?
Yeah.
Well, you're right, Christina. Yeah. So statisticians are not necessarily good at grammar. So yeah, right. It is kind of funny. The English major in me is cringing. I know. Yes, that is true. You are very correct about that. All right. Well, I'm trying to look at the chat to see if there anything.
Yeah.
Anything else?
There's something about other values for t-tests besides the p-value. There are effect sizes and we can certainly post some.
Yes.
And some people use effect sizes and p-values, and so we can post some resources for that in there so that you can do some continued reading on that. Yes,
and that's an important thing also. So we will send out some additional resources for those of you that need that. All right. Well, I'm going to move on and kind of walk through the second one a little faster because I know we're coming down on time and I want to make sure we share our resources as well with you. So I'm going to go ahead and move to example 2, but just go through the motions a little quicker with this one. Let me increase my Zoom here. So this one, in this example, we actually have 2 different samples. So this one, we're going to use the unpaired this time. And so we're comparing virtual to in-person delivery of the exam prep course to see if that made a difference in how our folks did on the exam. So again, we go up and we do our data and we go to data analysis, same menu, but we're going to make a selection that's different here. This time we're going to select the t-test that says to sample assuming unequal variances. We don't know if our variances are equal in this sample, so we're going to err on the side of caution and use this one in this case. So this is 2 different samples unpaired. So I'm going to hit OK. And we're going to go ahead and select our data. I'll move a little faster through this since we showed this to you earlier. And I'll do my second variable. Right. Same here, same here, same here. There's that significance level again, the 0.05. We've got that in there. Everything else looks good. So we're going to hit OK. And I'm going to increase the font here. You can see it a little better. All right. So this is our unpaired t-test, and I'm going to increase these we did earlier so you can see that too. So we got rid of some of this. And don't need much of that. Delete that too. All right. Last but not least, to delete. All right, so we can see our means here. And you see that for virtual, it was obviously less than the in-person, right? So we see a difference, but something I want to point out here is just because we see the means are different doesn't mean that we have statistical significance, right? So you could present this to your folks and say, well, we saw an increase, but the point of doing statistical tests for you in prevention is to show the evidence that it worked. That's why we go a further step with the statistical test, okay? So we look at our 2-tail here, and I'm going to highlight this like we did the last time. Okay, that's that p-value. So what do you all think? Is this significant or not? Let me pull up the chat here. Very, yes, very, right? Our alpha is 0.05, this, and we have 0.00035. We're way down the line with those decimal places. So yes, very significant. So we can say with confidence that our means here for virtual and in person were statistically different. Even though we saw that there was some difference there in the means, we didn't know if it was statistically significant. So now we have evidence for that to share with our folks. So in prevention, what's this going to mean, right? We have a significant difference in scores for prevention certification exams for an in-person delivery having the favor here. So when we're making financial decisions about what we're going to invest in, we would probably say it's worth it to have people to travel, right, to an in-person delivery of this exam prep course instead of doing it online. Now, again, this is fake data. Don't any of you go around saying, well, Nicole said that, you know, in-person is better. This is fake data, so don't do that. But in this case, it would help us make some really strategic decisions about how we move forward. Thank you, Lisa. Right. Okay. Well, any questions before I go back to the PowerPoint? So I know we're getting low on time here, but the demo is really important. Bev's posted another resource there. Thank you, Bev. All right. Okay, well, I am going to go back to the PowerPoint here. And you all let me know if you can see that.
Not yet. We're still seeing the Excel.
Okay. Thanks, Sheila. All right. So we are now going to go on to interpreting and communicating our findings. And this is really one of the most important pieces. So we can use our charts effectively. We've got to minimize the clutter. We want to make people care about our findings, right? And sometimes we have to really think about all the time, we have to think about who we're communicating our findings to know what that means. We want to use appropriate data visualizations for our audience and really tie things back to that logic model. So we also want to make sure we sharpen the message. And by sharpening the message, I mean, let's say we have a message given our results that the in-person delivery was more effective than the online delivery, but maybe we want to sharpen that message by adding a statement by how much, et cetera, so that we really bring our point across. And when y'all are putting up your charts, you can always use sort of a statement at the top instead of just a boring title. And Sheila does a great job of talking about this and her visualizing with data in Excel recording. So I'd encourage you to look at that, but really sharpening that message at the top of your chart to hone in on what you want them to notice about your visualization. So what are some things that you think we can do with, given our example or given some things in the data you have back home that you can do to sharpen your message, let's say around pre and post tests? Okay, bar charts. Yep. Yeah, we could use a bar chart to show the difference in the means. Pie charts. And pie charts can be a mixed bag because as long as we use that for, a certain number of categories, but if we get too many, they can be a little misleading too. So they can be a mixed bag. With pre and post test data, we would probably want to use bar charts or line graphs that show the means and the differences there. Katie says, good point. Yeah, they can get a little confusing. They're kind of pretty, but they can get a little misleading, especially with this type of data. Now with demographics, as long as you don't have too many categories, they can be effective. All right, great. Thank you for including some of the things that you would do there. That's awesome. All right. And let's go on. So one of the things that we wanted to show you was how we visualized what we did today. And so one of the ways you can do that too is when you take data back to your communities, you can put it in the logic model, just make sure that it's graphically appealing, right? So put in your priorities and your goal, what you intended to do, have your inputs for your program there. So in our case, we've got our trainers, we've got the technology, the curriculum, the funding, and the training sites. And then for our outputs, that's where your participant numbers go, how many activities you did, those kind of things. But then you see the significant outcomes. So you can add this to your logic model and talk about how you saw the statistically significant increase in test scores from the training. You can talk about how the in-person instruction had higher scores than virtual, and you can give that probability level that it was less than 0.05 to show statistical significance. So that is one way you can use even a logic model as a visualization to show your alignment, your connections with all the information that you have. And Bev is posting some things too, lollipop charts. Yeah, instead of chunky bar charts, they can also be great. Stephanie Evergreen, yes, Connor, Stephanie Evergreen is awesome. We actually have one of her resources in the back of this PowerPoint. And so she has some great data viz stuff. And then Katie, I never knew those had a name. I'll remember it now. Awesome. Great.
And infographics are also a great way. And I see that someone suggested that as well.
Yep. That is awesome. Any other ways you all have used data viz to show some pre and post test stuff that we haven't posted in here? Please feel free to post that in the chat. Always like to learn, learn what's going on out there in the field. So I know a lot of you have a ton of experience too. So keep posting those in the chat. So what's the story? Why do we do this? It really comes back to, in prevention, we're constantly being questioned, really, like, is what we're doing working? Whether it's funders, it's, our communities, our participants. And so it's really important that we do these things to show that what we do works, because public health and prevention, when it works, nothing happens, right? So being able to statistically show that these things are working and the interventions we do make a difference is extremely important for the future of our field as we move forward. And that's really why we have done a lot of data trainings, and especially in this past year for our prevention specialists, because it really is a skill that will set you apart even from your colleagues. You know how to do this, you know how to do some of this stuff, and man, you are going to be rocking and rolling at showing funders, what's going on and all the great things you are doing and the successes that you're having. So it's a great skill to keep boosting. Oh, nice. Yeah, we've got some chat going on too about what is one thing you have learned that you didn't know before about the live demo, and some great stuff coming through. Data analysis tools, using Excel, double clicking to auto format. Yeah, that's a handy tool, especially when you've got a lot of data. We did not have a lot of data, but when you have a lot of data, that thing will automatically get your column where it needs to be. See if we've got some others. Sheila and Bev, are there any that you want to highlight from the chat that you're seeing?
I just put in there some infographic resources, some free and pay sources for them. That's a whole nother skill to learn that is useful when you're working with data.
Very true. Thank you, Bev. And I will turn this over to Sheila, who's going to wrap us up, and we'll also have some time for Q&A. So I just want to turn it over to Sheila and thank you all. You have been amazing participants, and I hope you see why this is so important as a prevention specialist. I am a data person, but I am also a certified prevention specialist. I believe it's very important that we know how to do this work and that we show that what we do is effective. So thank you all for going with me through this today, and I appreciate your patience, because I know it's not an easy topic to walk through. So anyway, I'll let Sheila take it away.
Yeah, we've definitely had a lot of interaction, and I can see people have a lot of knowledge. I see someone said they love Canva. I love Canva also. There's a lot of great resources. Bev's put a lot of great resources in here, and we have a lot more coming up. But wrapping up, we have one more question. How will you apply what you've learned today to your work? Let's see.
I like that one. My brain hurts.
Well, that's okay. That's okay.
That's wonderful. My brain hurts every day.
Christina said she's definitely going to use the data analysis tool. Awesome.
I'll be using t-test with our retrospective pre-post analysis for surveys from now on. Excellent.
Very good.
Adding the tool pack, passing this to my coalitions as well as use it myself.
Oh, that's wonderful.
Yeah.
Yes.
Awesome.
That's a real leader right there. When someone learns something and they pass it on to someone else and they use it, that is a leader.
Absolutely.
Yep. And it looks like some of you have just finished a program and need to analyze some data. So this was good timing for you.
Right. Nicole and Bev, do y'all have any final thoughts?
Just that, I can't stress how important it is that, you really think about your audience too, and how you're going to take this back to them. So, the logic model may be a good way for you to do that, or it may not be. And ask the people that you're going to be working with what they would like, what's important to them. So that's another really important thing that we couldn't get through as much today, but we really need to go back to our people and ask our people what they want in terms of, visualizations and communication. So
nice. And as we've said, we are going to post this. We'll send this out. You'll have the recording so you can walk side by side with Nicole and use the spreadsheet and follow the instructions. Bev did a cleaning to mapping in Tableau training, and I go back to our webpage all the time and I pull that and walk through it. So it'll be available for you and you can go back and do it again. And let's see, I was going to ask, does anyone have any questions about this training for Nicole or Bev or me?
Sheila, someone has asked, could we send the links to the other data analysis trainings?
Yes,
so
and
they can get that on the PTTC website, correct?
we do have that. We do have those in our resources in this PowerPoint. So that will be a part of our materials as well.
Yeah, I'll show that for you all right here. We've got all the Ditching the Discomfort 5-part series, the data story, and we also have From Cleaning to Mapping and Tableau.
Yeah, those are in there. Sorry about that. I forgot that you had put those in there.
Yep. Oh, and Richard's posted them too, some of them. Yeah.
Thank you,
Nice.
Richard.
Yep. And I'll go back to our evaluation.
Yep. So yeah, there's the QR code, and you can use your phone camera, and go to it on your phone, or just Richard's going to post it in our chat so you can link to it. And we really appreciate your feedback. It helps us identify what trainings we need and keep offering these kinds of services.
Yep. And you'll also have an opportunity once you close out, the evaluation will come up as well. And we'll send out a follow-up email too. So you'll have multiple opportunities. We really encourage your feedback. So.
Okay. And if you have any questions about this, or you'd like customized TA about this topic, or have different prevention or data topic questions, there's Nicole's contact information. And you can connect with us through our website, that we do keep all of our trainings on there. So that we have a lot of trainings about data. So that's a great place to go. And then also sign up for our email list, because we send out a lot of fantastic resources there, as well as let you know about our upcoming events. Mm-hmm. And so our references, Nicole did include both those two case studies that she talked about early on. So this will all be in our materials, so you will have access to that. And then we also have our resources. And there's our data series, the 5-part series. So it is 5 different trainings with different topics, the data visualizing with purpose in Excel, and then choosing the right statistical test types and examples, And then I know that Bev has posted a lot of great examples or a lot of great resources in the chat. So I'm so glad everyone came. It was a great training, and I know I learned a lot.
Yeah, it was awesome, and you all have been awesome participants.
Amazing. Yeah.
Oh, wonderful.
Christina wants to know why we're not doing a pre and post.
We did not want to overburden our participants.
Yes.
Else to think about,
No.
especially for a webinar.